Okay, so the volunteer has done the figure 8 exercise to warm up. She has done the passive to get acquainted with the logic of the shapes. She has done the semi-active to help her interpret more accurately where the shapes are placed on the page. And now she's going to try to interpret the shapes in the advanced mode, which is high analysis. I've instructed her to look at all the corners, look at the shapes in relation to one another, to use some type of mechanism to help her measure. And I'm going to ask her now, do you have any questions before you begin? I just want to point out, you've never done this before, and you said that you can see the difference of the intensity of concentration from the beginning to now. How would you describe what's being asked of you now compared to the passive one? And you don't have any kind of neurological problem, but what is it? What is your feeling? Are you feeling anxious? And
yeah.
Why are you
anxious?
I feel
like I need to try a lot harder.
You got to focus,
yeah.
right? Okay. You don't really have to pressure yourself like that. I just want you to go through the exercise the best that you can. Okay? Mm-hmm. I would never do this to a client because sometimes it takes them 6 months to get to the second type of drawing. Okay? We're just doing a exercise. Please begin. And why are you doing that? You're measuring,
how far I need to go.
But you're measuring from the side of the shape of the page into the shape, right?
Yep.
Okay, good. Excellent. And you're marking your spots. Excellent. Perfect. Oh, you take good direction, you know that? How does it feel with measuring compared to doing the semi-active? Do you feel more comfortable now with this?
A bit, yeah.
Okay, good. Probably because you had some exposure to the shape before?
Yeah.
Good. Perfect. You can measure from the bottom to the top too, so yeah. Don't be afraid to correct it. It's okay. You don't have to be perfect. This is not about being perfect. It's about the sensory stimulation. That should relieve you somewhat, shouldn't it? We are really shaking this young lady up because we're getting all the sensory stimulation going on. So it's kind of intimidating to be asked to do analysis of something abstract. I have news for you. The hardest thing in the world you could ask somebody to do is copy an abstract shape exactly, because there's no logic to it, you know? She says, don't talk to me, I'm busy.
Sorry.
I'm trying to, don't talk to me. You're messing me up. Good. Good analysis. Okay, we're going to stop the exercise. You get the idea, people. And, you know, of course, you would never ask a client to move through these exercises the way that I have asked this volunteer to move through. You would go slow, you would go cautiously, you would get feedback from the client, and you certainly would do assessments for distress. All right, thank you.